Good morning, students, and welcome to Lifespan Development. This is Chapter 7 of your Emergency Care and Transportation of the Sick and Injured. At SCI Institute, we do welcome you to this particular chapter. We're going to cover over the different growth development phases of us as human beings, and hopefully we'll have a good time doing it. So as an introduction, you folks, as EMTs, you need to be aware of the different physical and behavioral and mental changes in people. They go through very distinctive changes throughout their stages of lives, and understanding these changes is going to help you guide your assessment and your critical thinking for taking care of your patients. In general, the younger person, the faster the normal pulse and respiratory rates. Normal blood pressure values, they vary widely between the different age groups, and they tend to increase with age. This is vital signs such as blood pressure, pulse, respirations, those kind of things. Newborns. A newborn is considered from birth to 1 month. This is going to be very important to understand when you're doing your Platinum Planner entry for your patient care reports, because the selection or the type of patient you're taking care of falls within that category. So newborn is considered birth to 1 month, and infants are considered 1 month to 1 year. The list of developmental changes occurring in the first year is very long and it's substantial. So you can look at this in your book. Weight specifically, newborn usually weighs about 6 to 8 pounds, roughly 3 to 3.5 kilograms at birth. The head is much larger proportional to the body. It accounts for 25% of that child's body weight. After week 2, infants do grow at a rate of about 1 ounce or 30 kilograms per day, doubling their weight by 4 to 6 months and tripling it by the end of the first year. Okay, let's talk about the cardiovascular system and the pulmonary system. Cardiovascular system meaning their heart. Pulmonary system meaning their lungs. Okay, and they do work together in harmony to be able to provide for circulation. The cardiovascular system at birth, newborns make a transition from being used to fetal type of circulation, otherwise inside the mother's womb, to extrauterine circulation, which means outside of the womb. So there's a lot of changes that do have to happen for that circulation system to make that transition. The pulmonary system, prior to birth, a newborn's lungs have never been filled with air. They've always had fluid going in and out intrautero or inside the womb. They've never actually exchanged any gases. So after birth, this is new for them. So their first breath is actually facilitated during birth. It is when the chest passes through the birth canal and increases intrathoracic pressures. Infants younger than 6 months are particularly prone to nasal congestion. They have lots of mucus and lots of secretions, so that's something to be aware of that you're going to have to make sure that you're in your assessment you're managing. Infants has a proportionally larger tongues and shorter, narrower airways, so airway obstructions are much more common in infants. That's why in their first few years or a couple of years of their lives, they're really on soft foods and liquids, because they are very, very common to get those obstructions. The rib cage is less rigid and the ribs sit more horizontally than what any other more lateral and more encompassing of the chest. When performing bag valve mask ventilations, remember that an infant's lungs are very fragile. They're tiny little bags, and you want to make sure you're using the right equipment and you're not doing any forceful ventilations or overinflation, because that would perhaps cause barotrauma due to the pressure. You might even pop a lung and cause what's called a pneumothorax. Respiratory muscles, they're immature, and the number of alveoli in the lungs are relatively low. The alveoli in the lungs, we'll talk about those later in human anatomy. We'll talk about those specifically, the fact that that's where the exchange of gases happen. Respiratory problems in the very young can turn life-threatening. If they can't exchange oxygen, they're going to degrade very, very quickly and get very sick. Okay, continue on the nervous system. The nervous systems, just like everything else in the infant, is beginning to develop. It continues to mature after birth all the way to the day that we die. A newborn with certain reflexes, they're born with these reflexes, and these are very important to remember. There's a couple of them I want you to remember right off the bat. Moral reflex, okay? Moral reflex is when the newborn is startled. They go, like that, okay? They open their arms wide, they spread their fingers and appear to be grabbing for something. This is very normal, and if they don't do this, this is a problem. Then we have what's called palmar grasp. That's when they grasp with their palms. It occurs when an object is placed into their newborn's palm and then they squeeze on it. Next is rooting reflex. This is when somebody touches a newborn's cheek. It will instinctively turn its head towards the touch. These are all good signs. These are things that you can do in your assessment to make sure that the child is developing normally. And finally, sucking reflex. When the newborn's lips are stroked, they automatically start sucking. That way they can feed from their mother and get the nourishment that they need. Okay, a newborn, when they're born, you have what's called the fontanelles. This is what you see here in this particular diagram. The fontanelles are gaps between the cranial bones connected by flexible fibrous tissue. These bones eventually grow together and fuse into the skull itself. So what I'm going to do, I want to show you a couple of things here. This is the fontanelle, okay? This item right here is the fontanelle. Here in this area. Okay, these are all the gaps. And this particular opening, this is what allows the cranium to flex when they're being born. Otherwise, you'd have one big giant head. It allows it to cone shape, so it facilitates birth. Now, when I said exactly in the lecture, we're talking about these fuse together over a period of time. Generally the posterior, okay, which posterior is the back here, okay, it closes by 3 months. The anterior fontanelles closes between 9 and 10 months, okay, anterior, meaning up in the top. This is where we're talking about here, okay. See the sign says right there, anterior. And then finally, talking about the depressed fontanelle, if they're flat up here on the top, you don't see a little ridge there. That may indicate that the patient is dehydrated. Bulging fontanelles are often a sign of increased intracranial pressure. So these are the two things that you definitely do not want to see when you're looking at a child. But if you do see them, you need to report them to the paramedic right away. All right, continue on with the nervous system. By 2 months of age, infants can track objects with their eyes and recognize the familiar faces. So for a 2-month-old, when you walk into the room, they should be looking at you. They should be able to follow you going through the room. That is normal activity. If they don't, that is abnormal activity and something to take note that maybe the child is not either A, developing very well, or truly sick. At 6 months, they can sit upright and they begin to make cooing and babbling type of sounds. By 12 months of age, an infant usually has begun to walk, point, and talk. So this is a very important milestone. This is 1 year. Okay, 12 months of age, they should be able to get up and start moving around at this point. They move into that 2-year-olds, what we call the terrible twos, into that toddler phase. So we're going to talk about that next. Oh, don't forget about the immune system. Okay, they maintain some of their mother's immunity, especially if they're breastfeeding. If it's they receive that antibody through breastfeeding, so therefore it strengthens their immune system. Okay, so psychosocial changes, for the newborns and the infants, they begin at birth and they evolve as the infant interacts with their world. Crying is the main method of communication in distress. Soothing an infant should be relatively easy for the parent or caregiver, such as by holding, cuddling, or rocking the infant. They still have a real strong attachment. So it's usually very, very seldom do they not. And if they cannot be comforted, something's wrong. Something is not being corrected that the infant needs. If all obvious needs have been addressed and the infant is still inconsolable, it could be a sign of significant illness. Okay, so other psychosocial changes at 2 to 6 months, the infant has increased the awareness of their environment and will use both hands to examine objects and explore the world. At 6 to 12 months, infants begin to babble, and by their first year, they can say their first word. They usually tend to explore their world by picking up things and placing them in their mouths. Everything goes in their mouths. That's how they explore the world. And ultimately, that can cause them to choke on it. So there's a high incident of airway obstructions with this age group. Bonding is based on a secure attachment. We have anxious avoidant attachment, which is found in infants who are repeatedly rejected. So this is something you can look for a child or an infant that's being neglected. And then children show little emotion response to their parents or caregivers and treat them as they would strangers. That's how this anxious avoidant attachment develops into when they're a child. Separation anxiety is common in older infants. If you remove them from the parent, they tend to cry. And also, trust versus mistrust refers to a stage of development from birth, about 18 months, which involves an infant's needs being met by their parents or caregivers. So trust versus mistrust, you're going to see this specifically as a test question for sure. And separation anxiety, and then also anxious avoidant attachment. So I'd be looking over those in your book and make sure you understand those concepts. Okay, so let's talk about the assessment. We always begin the assessment by observing the infant from a distance, preferably in a parent's or caregiver's arms. So when you walk in, what do you see? So what does everybody see on this photograph? This child look upset, mad? I mean, if you look at this child's expression, okay, looks pretty upset to me for whatever reason. This child could be upset because you've walked into the room and they know you're a stranger and they're afraid they're going to get a shot, or they could be sick. They could not feel well. Whatever it is, it's going to be your job to determine between you and the parent on what's wrong with the child and what you can do about it from an emergency perspective. All right, so in the assessment, what it does, it provides, you need to provide as much sensory comfort as you can, such as warm your hands at the end of your stethoscope so it's not cold when you listen to their chest. Offer a pacifier if the parent or caregiver allows it. Have the parent or caregiver hold or stay close to the infant during all procedures. And then plan to do any painful or uncomfortable procedures at the end of the assessment. All right, so complete each procedure efficiently and do avoid any interruptions. Explain each procedure to the parent or caregiver before you perform it. Because the procedure and the infant's reaction, it may be upsetting. So you don't want to explain something and cause the infant to be upset and the caregiver or the parent not being informed that this may happen. So be sure that you involve them as much as possible. Okay, so let's talk about toddlers. This is from the age of 1 to 3 years old, and preschoolers, which are ages from 3 to 6. There are a lot of physical changes now. The cardiovascular system of a toddler or preschooler is not dramatically different from an adult. Toddlers and preschoolers do not have well-developed lung musculature, so therefore they're unable to sustain deep or rapid respiration for an extended period. This is why if they're breathing real fast, they're going to wear out. They're going to tire out very quickly, and then they're going to start to decompensate and become cyanotic. Otherwise, they're going to be turning blue. Weight gain should also level off. They should begin to normally develop weight, unlike when they were an infant. They were rapidly developing weight because they were feeding high concentrated foods and fats and, sugars to a point through carbohydrates specifically. So they were doing quite well at then. So now it should begin to start to level off. The physical changes, between 6 months and 1 year of age, the infants have lost that passive immunity. They're no longer breastfeeding. And so they're not getting the immunity that they're picking up from the mother. So therefore, exposure to viruses and bacteria initiate the development of antibodies now, resulting in the acquired immunity. So they go from passive immunity, getting from their mother, and what they had intra-utero, their exchange with her blood, into what's called an acquired immunity. We're all supposed to get it. It's all part of the herd system of immunity. We all get it by being in contact with each other. We're exposed to different types of viruses and bacteria, so we begin to develop those antibodies. That's natural. That should be happening. Neuromuscular growth, man, it starts to shoot like a weed. As you can see, we had that real toddler, true toddler, and now we have this one. This child represents somewhere between that 3 to 6 years. This is the preschooler. Their growth is very, very massive. They go very, very quickly during this period. Okay, so other physical changes. Toilet training, woohoo! That usually is completed somewhere around 28 months of age. Because of the lack of molars, which are teeth, toddlers may not be able to fully chew their food before swallowing, which does also lead to an increased risk of choking. Psychosocial changes. The psychosocial challenges for this age group is sometimes referred to as the autonomy versus the shame and doubt. So I want you to remember that. Autonomy versus shame and doubt. You're going to see that within your test. At 36 months of age, basic language is now being mastered. Interactions by playing games with other children begin. This is when they truly begin to kick that psychosocial stuff and those changes into gear because of exposure to other kids. 18 to 24 months, the cause and effect now starts to come into play. They begin to understand that if they do something, this is going to happen. That's what cause and effect it means. And you're going to have to understand that because you will be tested on that as well. Children do begin to learn to recognize gender differences by observing role models. So they know the difference between a man and woman. Usually they start picking this up out of the home, between the parents and even older siblings. So in more of the assessments, talking about how do we assess the toddler, what do you guys see in this picture? What do you see? First off, you see mom, okay? She's holding this toddler and it's got one of the favorite books, okay? The caregiver, this is you, okay? All right, there you are. You're wearing a mask so that you're not getting this child more sick because you're spreading her germs, because her wearing a mask will not work, okay? That's just going to cause a lot of problems. So you're trying to avoid giving her any exposure or to get any exposure from anything she may be coughing into the air. And notice that the caregiver and the toddler are interacting right now. Okay, she's showing her stethoscope, which she's already pre-warmed up against her arm or something so that she can listen to her heart and also to her lungs. And it's going to be warm versus cold. So basically what's happening is they're allowing the toddler to hold, okay, the comforting object, which is the book, and then demonstrate, you can also demonstrate on a doll or some kind of stuffed animal first with the child so that they understand that it's not going to hurt them. If it's good for their little toy, then it's good for them. All right, so toddlers have trouble describing or localizing pain because they don't have the verbal ability to be precise. They can't say my elbow hurts or my finger hurts. They're not quite there yet. However, they should be able to identify and name major body parts like arm, leg, foot, feet, those kind of things. So that's very helpful. The use of visual clues and the Wong-Baker Faces Pain Rating Scale, which is a group of faces on a card, it might be able to help in this age group. The faces are like, really sad and really red and painful kind of thing, all the way up to very happy. So he gives them multiple different faces to choose from. So it could be very helpful. If the primary assessment reveals no life threats, you can begin your assessment at the feet. So start at the feet. If this is not a critical child, and remember, these are to assess for life threats, your primary, the ABCs. If they don't reveal any life threats, then start at the feet and work your way up. The feet are very less invasive, and they don't have a problem with that. You kind of work your way up from the bottom to up to the top. All right, so preschool. Preschool age children can understand directions. They can be more specific in describing their sensations and also to identify any painful areas when questioned. They can get fairly specific. Finger, knee, elbow, those kind of things. Teeth, ear, right, left, those kind of things. The child's history will be obtained from the parents or caregivers, so you're going to get that information usually from the parent, usually from those folks here. Communicate simply and directly. Don't use fancy words or any of that kind of stuff. Be very simple, very direct. What do we see here? Right. You see that the child is being offered by the caregiver a bear. Okay. All right. Some kind of toy. And that can be helpful in the assessment itself. Does it hurt here? Does it hurt there? If the child is having problems with stimulation, tactile stimulation, with you touching that child, because sometimes that happens, especially if they're a special needs child. So tell the child what you're going to do immediately before you do it. Don't surprise them at all. Surprising them is not a good thing. That preschool age child is very easily distracted with counting, games, small toys, conversation, those kind of things. Appealing to their imaginative thinking may very well allow the treatment to go much smoother. So remember, this particular age group is very imaginative. They're working on their world, they're working on their concepts and how to live their daily life, happy and go lucky. Children often believe that their thoughts or wishes can cause injury or harm to themselves or to others. So, don't assume that a preschool age child has an accurate understanding of the situation. They don't always have that. And, never lie. If you ever lie to a child or any patients, once you've lost that confidence, you've lost that trust, you can't get it back again. It's very, very difficult to do so. So, don't lie to them. And like we were talking about earlier, if there's no life threats, begin at the feet and then work your way up. Modesty in this age group does begin to develop. They don't want to be disrobed. They're embarrassed, those kind of things. So keep them covered as much as possible and only remove the things that you got to remove that interfere with your assessment. Okay, so school age, 6 to 12 years old. Lots of changes going on here. A school age child's physical traits and functions continue to mature at a very rapid pace. So, growth of 4 pounds or 2 kilograms or 2.5 inches each year is not uncommon. Somewhere around that group, their permanent teeth start to come in, so they can chew much better. So the airway obstructions begin to reduce, and their brain activity increases on both hemispheres or both sides. They begin to be able to rationalize and think. They know cause and effect already, so now they're starting to become more independent. They begin their reasoning. There's various types of reasoning that we're going to talk about. And you need to know these because you're going to see this on your test. Pre-conventional reasoning. This is when children act to avoid punishment, okay, and get what they want. They don't want to be punished, but they still want to be able to get what they want. The next is that conventional reasoning. So you have pre-conventional and conventional. Conventional is when children look for approval. Generally, these are from peers in society. Post-conventional reasoning, all right, we talked about conventional. Post-conventional reasoning is when the child begins to make decisions guided by their conscience. So they know what's right and wrong, and they begin to feel bad when they do something wrong. especially if their peers or society does not accept it. So they have what it's called post-conventional. This is where they really begin to learn and they begin to model who they are, okay? And then finally, the self-concept and self-esteem. This is a big thing, okay? They know who they are. They begin to be proud of themselves, especially if they're fostered as, from home. The parents are saying, "I'm so proud of you. You're doing such a good job." That needs to happen. Or, "Hey, I was not proud of you today because you did something bad. You spoke out against the teacher, or you did something, whatever it was that happened at home." They need to still know cause and effect in order to maintain discipline. So that's all part of that development of concepts and also the self-esteem. All right, so assessment with this age group is more like when you're doing an adult assessment. You need to talk to the child. They understand that they understand pain. They understand being taken care of. They understand parts of their body. And you're not talking to only the parent or caregiver at this point. You really need to involve the child in this while getting that medical history from the parents, so on and so forth. I usually put somebody else, that's their role, is for them to get the sample history. The signs and symptoms, the allergies, the medications, past medical history, the last meal, and the events leading prior to. These are all things that we need to get that sample history, and somebody else can get that for you. That's most helpful. Children are usually familiar with the process of a physical exam at this point because they have a primary care doctor, okay, a pediatrician. So begin this particular assessment with the head and move towards the feet. It's okay at this age group. They understand, they're not going to be afraid of you, usually. When possible, give the school-age child simple, appropriate choices, such as, would you like to sit up or lie down? That's a very simple choice, one or the other. Respect the patient's modesty during the exam because they're definitely beginning to be more self-conscious about their body and their growth of their body and who they are. Children begin to understand that death is also final at this point, but may not understand what death is and why it occurs. This may increase anxiety about illness or injuries for the child. Okay, here we go. Adolescents, 12 to 18-year-old. I am independent. I will do what I want, when I want, what I want. This can be a very challenging time for parents, but it's a great time to be and a great time to model on who you're going to be for the rest of your life. In adolescence, the ages are 12 to 18 years old. Vital signs begin to level off within the normal adult ranges. Pulse rate is generally between 60 and 100 beats per minute. Okay. You'll see that on a test for sure. And respirations are 12 to 20. Okay, and systolic pressure is 90 to 110. And remember that systolic is that top number. That's the pulse point or the pressure wave that comes through at every beat, or the beginning of when you hear it beat when you're listening or auscultating for your blood pressure. This number needs to be greater than 90. Anything less than 90 in this particular age group could very well mean this person is hypotensive and that they're having some kind of event where they've lost fluid or they've lost blood. So it's very important to understand that, or systemic vascular resistance. So this is a very important number for adults and, of course, the adolescents during this age group. So talking about the adolescent experience, a 2 to 3 year growth spurt is what normally happens here in the first, at beginning at the age of 12 and then levels off. They have an increase in muscle and bone growth and body changes. Girls usually finish their growth spurt by 16, and boys usually by 18 years old. The endocrine and reproductive system matures, so hey, they can have children at this point. And secondary sexual development takes place. They begin to grow pubic hair and axillary hair, otherwise hair under the arms. Their voices start to change. And in ladies, their menstruation begins somewhere during this period. And the capacity for reproduction is attained. There you go. That can happen. And sometimes it does happen. All right, so adolescents and their families often deal with conflict. Okay. As adolescents, they begin to seek and express their independence from their parents. That's their number one goal. They are young adults and they want to grow to be a good adult or whatever they're going to be. Privacy and personal space become a very big issue with this age group. They're very self-conscious, okay? It begins to increase. Adolescents may also struggle to create a sense of identity during this period. The social media things are very, very difficult during this part of their life. There's so much that goes on with it. You know, trying to gain acceptance from their peers is a big thing. They become very concerned with their physical appearance and how they're perceived by their peers. Sexual orientation also begins to develop. A person's emotional, romantic, or sexual attraction to other people and gender identity begin one of the most innermost concepts that they're trying to work for to understand who they are, the sense of self. They develop highly during this period because they're growing into who they're going to be for the rest of their life. Not knowing how to express or manage these intense emotions does come along and become a factor in this. And unfortunately, not able to deal with it and the pressures that come during this age group could cause suicidal ideation and even some thought, some actions towards, trying to achieve that if they feel like they're failing during this period of time. This is a very sensitive and very critical time of the age group life of the child because of these changes. They're just a ball of emotions at this point. And they need to be watched closely and helped and make sure that they get the help that they need if they begin to show these kind of tendencies of suicidal and harmful thoughts. Sexual orientation and gender, like I said, it really begins to develop just during this period. They often want to be treated like adults, yet, they still need their parent support. Sometimes they get into high risk behaviors such as smoking and illicit drug use, unsafe driving, unprotected sex. Other high risk behaviors tend to peak around the ages of 14 to 16 years, along with some have antisocial behavior. Not everybody, but some have antisocial behavior. And also they begin to experience a lot of peer pressures that mold and change their thought processes. Pretty much so they develop their code of personal ethics during this period, and that is influenced partly on parents' ethics and values and partly by their peers and personal experiences. People ask how much of that is balanced. Is it 50-50? Is it 60-40? It all depends on the child. All depends on how much of the peer pressure in their personal experience are dramatic or over dramatic or lulled versus what they're getting from home from their parents. But just remember, it is very critical during this period to nurture and culture that to what you would think would be something that would make this person a very bright, productive person in the world. So foster that kind of behavior development. Good stuff and good times. Okay, other assessment considerations or assessment considerations for the adolescent. Adolescents can often understand complex concepts, and treatment options, splint, non-splint, pain medicine, those kind of things. So provide them with information when they request it. When the adolescent condition is stable, discuss the situation and allow the child to be involved. This adolescent period, they can do a lot on their own and they can make decisions a lot on how much care that they're going to get and how much pain they can manage. Bodily image and physical modesty are very, very important considerations when assessing an adolescent. Have an EMT of the same gender perform the physical examination if possible. Right, so if you suspect a patient might want to share some information that they don't want their parent or caregiver to know, try to interview the adolescent without the parent or caregiver being present. Pregnancy is one of those things, or an STD, that kind of thing. It's very embarrassing. They don't want mom and dad to know about it. So try to facilitate that as much as possible. Explain any necessary procedures and assess their level of pain by observing facial and body expression, as well as asking questions The adolescent can definitely be reserved and may not request pain relief even when they need it. So physical changes, early adults. This is from 18 to 40. Their vital signs don't vary greatly at this point from those seen through adulthood. A typical pulse rate will average somewhere around 70 beats per minute. Okay. The respiratory rate will stay somewhere between the range of 12 to 20 breaths per minute, and the systolic blood pressure will be between 90 and 120. From age 18 years to shortly after 25 years, men and women typically reach their physical peak. Lifelong habits and routines have now been well established, and they will continue on for the rest of their lives. In the latter years of early adulthood, the effect of aging gradually becomes evident. Psychosocial changes in the early adults. They're focused really on family and career. Please remember that. You will see that on a test, family and career for the early adults. Although rewarding, life events also bring a lot of significant stress. Despite the amount of stress and change, this is one of the more stable periods of life psychosocially in the human being's growth period. So it is definitely a good part of your life. So once you get to that point, enjoy it. And remember that it's the best part of your life. The aging process continues to take its toll. Now we're up to 40 to 65 years of age. This is the middle adult. That aging process begins to take its toll. Middle adults are vulnerable to vision and hearing losses. Cardiovascular health becomes an issue and needs to be watched very closely. Cancer, the incident does increase. And of course, in ladies, their menopause takes place somewhere in the late 40s and early 50s. In this particular age group, they start having issues with increase in cholesterol levels, decrease in cardiac efficiency, and weight problems. They're very, very common. And it's much harder to lose weight at this particular period of time. Exercise and healthy diet can diminish the effects of aging, but this is one of those things in middle adults, they're trying to work on getting to their retirement years. They tend to neglect that, unfortunately, and they need to pay attention to that very closely. They need to get outside. They need to make sure they get a lot of exercise. Middle adults may also have conditions which they are unaware of, including diabetes and hypertension. So, focus, psychosocial changes. Focus on achieving life goals. This is where they're at. In this particular range, they want to reach those goals. They want to get to retirement or whatever it is they choose to do. Middle adults must readjust their lifestyles as children start to leave home. Finances become a more worrisome issues, having enough money to retire and to live the rest of their life comfortably. Generally, people of this age have physical, emotional, and spiritual reserves to handle life's issues. Middle adults may also find themselves caring for children, leaving for college, and caring for their aging parents as well. All right, so 65 years and older. Geriatrics is the assessment and treatment of a disease in older adults. Classic presentation of injuries and illness are often altered by chronic conditions, multiple medications, and the physiology of changing. As you can see here, this individual looks pretty healthy. He's out and about, he's doing, he should be doing, he's getting exercise, he's outside and that kind of stuff, but he may be on a plethora of meds to do so. You just never know. To provide effective treatment and understand the issues related to aging and modifying some of the assessment and treatment approaches is necessary. You got to be able to do this. You got to remember to go with the flow with it. Not all older adults are decrepit or have lost hearing or lost sense of taste or overweight. They don't all fit in that category. They all have different types of physiology and aging type of related problems or no problems. I know people that are 65 years and older that are not on a single med, which is phenomenal. And are in good health versus I know other people that are in horrible health and pretty close on the downward spiral for the end of their life. So got to know these things and got to understand them and how to deal with them. Avoid ageism. That is the stereotyping that older people, we just talked about that a little bit, that can lead to poor patient assessment and care. Common stereotypes include assuming that the patient has dementia, is hard of hearing, has a sedentary lifestyle, or is immobile. Other older people can stay fit and be active, even though they are not able to perform at the same level as they did when they were younger. But hey, now, their life expectancy, they're looking at is usually about 76 years. It's determined in part by birth year and country of residence. They are often able to overcome a lot of numerous medical conditions, but may need multiple medicines to do so. So, cardiovascular system. The cardio function declines with age, largely due to atherosclerosis. Heart rate and cardiac output decrease. The heart is less capable to cope with exercise or disease. The vascular system becomes stiff. The heart must work harder to overcome the vascular resistance. And the ability to produce replacement blood cells begins to decline as well. This makes any kind of trauma and the loss of blood volume more difficult to recover from. Respiratory system. The surface area of the alveoli decreases, as does the elasticity of the lungs and the strength of the intercostal muscles and diaphragm. You need to remember these because these are most certainly test questions. Surface area of alveoli decreases, elasticity of the lungs decrease, and the strength of the intercostal muscle and the diaphragm decrease. Notice that all of these words are decrease, decrease, decrease. If you just remember, if they're talking about 65 years of older, decrease and decrease and decrease, because you're going to see test questions that ask you this, both on your test here in school and also with the National Registry. Okay, by age 75 years, the vital capacity may amount only to 50%. We're talking about the respiratory system. Normal oxygen saturation level begins to decline to approximately 95%. The chest becomes a little bit more rigid and fragile. Cough and gag reflex diminish along with the ability to clear secretions. Older adults, therefore, are at greater risk of aspiration and airway obstruction. Smooth muscles of lower airway begin to weak, causing airway collapse and inhalation. This produces inspiratory wheezing, lower flow rates, and air trapping in the alveoli. Older adults are much more susceptible to lung infections. Endocrine system. Insulin production decreases and glucose metabolism slows. This is why they gain weight. A lot of people gain weight during this age period. The reproductive system changes to some extent. Hormone production for both sexes gradually decreases with age, and so therefore sexual desire may diminish but does not cease in its entirety. The digestive system. Changes in gastric and intestinal function or motility may inhibit nutritional intake and utilization in older adults. Tooth loss makes chewing difficult and taste sensations decrease. Saliva secretion decreases and reduces the body's ability to produce complex carbohydrates. The ability for intestines to contract and move food also diminishes, so many people have bowel problems. Gallstones also become increasingly more common, and there is definitely a decreased elasticity of the anal sphincter, which causes fecal incontinence. The renal system, otherwise their kidneys. We're talking about their kidneys. So between the ages of 18 and 75 years old, the kidneys lose 50% of their functional units, which is the nephrons. There are also a decrease in the blood supply to the kidneys as well. So their filtration capabilities begin to decline significantly as the age increases up to 75. There is a decreased ability also to remove those wastes and conserve fluids when they're needed. So therefore they end up having blood pressure issues and hydration issues. Motor and sensory and neural problems. The brain weight decreases at this point by 11% by age of 70. Motor and sensory neural networks become a lot slower. Neurons are lost, but this does not mean there is a loss of knowledge or skill. And then sleep patterns change. Older adults tend to develop biphasic or two-phase type of sleep cycle, where they have some in the morning, some in the night, or 2 different cycles within it when the night sleeping period is apart, is going on when they're sleeping. So there are definitely 2 different types of sleep patterns, which is called biphasic. All right, so age-related shrinkage does create a void between the brain and the outermost layer, the meninges, which provides room for the brain to move inside the cranium. So they're much more susceptible to injury, brain injuries, when they have a head injury, because the actual brain can move a lot more freely inside the skull. Peripheral nervous system slows with age. Sensations become diminished and may be misinterpreted. Then also prolonged reaction times and slower reflexes begin to contribute to a higher incidence of falls. They don't have the reflexes that they used to, so they may not grab something quick enough to prevent them from falling. Sensory changes. Pupillary reaction and ocular movements, or the eyes, become more restricted. Visual distortions are very common. Their actual vision begins to decline. Peripheral fields of vision begin to narrow. Hearing difficulty is found in nearly 1/2 of adults older than 75. Uncorrected hearing loss contributes to social isolation, cognitive decline, and also decreased mobility because they shut themselves out. If they can't hear, they don't understand, so they tend to shut themselves out and isolate themselves. Okay, so psychosocial changes. Many older Americans live at home. They may need assistance from family, friends, or home health care. They are shown to be relatively healthy, for the most part active and independent, but some do struggle. The increasing number of older adults in the United States as a result of the baby boom has increased a need for assisted living facilities. They grow on almost every corner, some kind of place, but that's a good thing. That means the growth patterns are meeting the needs or trying to meet the needs of the baby boomer period that are really beginning to need assistance at this point. So financial limits, they only have so much of an income because they're retired and they're getting Social Security. They're getting whatever benefits they have from their retirement, if they have any. And so therefore, it may restrict their access to healthcare and medications. Poverty is of a particular concern in this day and time for single and minority older women. One challenge facing older adults during this period is the growing realization of mortality. So that increases their risk for isolation and depression. All right, so let's do a review. All right, so when providing bag valve ventilations to an infant, what is the most important thing to remember? Blood pressure? Lungs are fragile? Infant grows at a rate of about 30 kilos per day or grams per day? Or an infant has a proportionally larger tongue than an adult? What do you think? We're talking specifically about the act of using a bag valve mask to ventilate an infant. What do you think? The answer is B. Remember, we talked about how fragile the lungs are. You can pop those little lungs. So first off, you need to make sure we're using the correct bag. You're using an infant bag valve mask, and that you're giving enough pressure not to cause barotrauma or pop in the lungs. So you're just looking for chest rise. Use the right equipment and don't overinflate. There's your rationale behind it. When you see an infant capable of reaching out to people and drooling, she is most likely to be what? 2 months, 3 months, 4 months, 5 months? What do you think? If you would answer C, you're correct. An infant's psychosocial development begins at birth and continues to evolve as the infant interacts with and reacts to the environment. At 4 months of age, an infant likely is to start reaching out to people and drooling. There's your rationale. 3, an infant who is repeatedly rejected experiences what type of attachment? Come on, you can do this. B, anxious avoidant. Remember, we talked about that. Is observed in infants who are repeatedly rejected. Again, remember, they show a little emotional response. They don't grow into their skin very well. They usually begin to develop isolation. So hopefully this doesn't happen. If you see this, in your assessment that they're avoiding, they withdraw from parents, those kind of things, make note of that. Pass that along to the caregivers. There's your rationale. Why do colds develop so easily in toddlers and preschoolers? Okay, here we go. D, all of them. They all contribute. Okay. They're beginning to lose that immunity that they got from their parents, the parent, especially the mother, the passive immunity. So they're starting to develop their immunity that they're going to spend the rest of their life with. So all of those are rationale. All of those contribute. Here's your rationale. The pulse rate of a toddler is, it's right out of your charts in your book. We talked about this. Good. If you said between 90 and 150, you are correct. The answer is B. There's your rationale. 6, a school-age child is looking for approval from his peers and society. Now, what kind of demonstration is this? What kind of reasoning? Remember, I told you were going to see these on test. What kind of reasoning? Looking from peers and society. Yay, if you said B, you are correct. Okay, during school age development, children begin to develop their self-concept and self-esteem. So it's critical for human development. Children who look for approval from their peers in society are demonstrating conventional reasoning. So they're conventional type of reasoning. Answer was B. There's your rationale. 7, self-concept is. Self-concept is. Excellent. You answered A. Self-concept is how we perceive ourselves. That was easy. It's rationale. Why should you be concerned about a 16-year-old patient who seems depressed? 16 years old, depressed. Yes, adolescents are at higher risk for suicide. So they're struggling to create their own identity. You got so much peer pressure, social pressure, those kind of things. If you have a 16-year-old who's depressed, that's a problem. High incidence or high population of suicide and depression. There's your rationale. Why do finances become an issue during middle childhood or middle adulthood, during middle adulthood? If you answered A, that's correct. The parents of adults in this age group are getting older and now need care. Most of the elderly in the United States are cared by family members inside the home. Therefore, a person in middle adulthood may need to manage children as well. They're leaving for college at the same time care for their parents. There's your rationale. Why is breathing more labor intensive for the elderly? You can do this. I know you can. If you answered all of the above, you are correct. All of these factors make breathing more labor intensive. There's your rationale. All right, folks, it's been great. I hope this was helpful for you to understand the growth and lifespan development of the human being. If you're a Martian, then we'll have another topic or another discussion at a later date. But anyhow, thank you much, and we'll see you next time.